Greetings, it's New Zealand naturopath Eric Bakker. I'm the author of a book called Candida Crusher and also the formulator of a range of supplements called Canzida. Thanks for tuning into my video. I'm going to do a few more videos in relation to comprehensive stool testing in response to a YouTube subscriber called Pro Chess Player. I think Pro Chess Player's name is Josh. So Josh, let's just start off with really explaining why I like stool testing and the benefits of stool testing, the advantage of stool testing, and why I believe it's definitely the gold standard to determine not just yeast infection, but a whole lot of different problems that potentially can affect the digestive system. I'm going to read a little bit of information out of my book. CDSA test times 3, so that's 3 samples. The identification of abnormal levels of yeast species, bacteria and parasites in the stool is a very important diagnostic step in therapeutic planning for patients in my clinic with chronic gastrointestinal and other symptoms that may be linked with a candida yeast infection. The CDSA test provides me, the clinician, with a wide array of the most useful clinical information to help me plan the most appropriate treatment protocol that is quite specific to the individual patient. Note how I said quite specific, because every stool test result will yield slightly different findings. So the findings are very important because they can pertain very much to that client and why that person has got a problem that's chronic, that's unresolved, for example. While this test is not for everybody because it's expensive, it will cost a few $100s, it can help solve the most difficult cases and provide me with all the answers I'm looking for. The CDSA times 3 with parasitology is the most comprehensive and commonly ordered functional stool test, assessing the widest range of intestinal conditions. This test will provide information on your ability to digest, metabolize and absorb nutrients, as well as report on all bacteria, whether they're beneficial, commensal or pathogenic. So whether they're good bacteria that perhaps can be good or bad, I call them the politicians of the gut, depends on where the majority are, or they can be very bad. So we actually can see if the digestion is moving from good to bad, or is very bad, or is predominantly good, just by the bacteria cultural panel. Let's have a look, where was I here? It will also show many different species of yeast, so not just Candida albicans, but there are around 19 species of Candida that can commonly affect the digestive system. So the common ones I see would be Candida albicans and Paralopsilosis. There's also Candida tropicalis. There are many other different types of Candida, but we haven't really got time in this video to talk about the specific species of yeast. I'll do that on another video. So that we can also see all kinds of intestinal parasites, whether you've got worms, eggs, larvae or protozoa. And that's why it's good to have 3 stool samples, because what you miss on the roundabout, you pick up on the swings. Okay? It's a bit like the fun park, you might not have fun on one thing, but you'll have fun on something else. So you won't be missing out. It's important to analyze both the intestinal digestion and absorption functions, as well as the levels of yeast, bacteria and parasites, because symptoms of maldigestion or malabsorption often mimic those of chronic bacterial yeast or parasitic infections. Additionally, chronic bacterial yeast or parasitic infections may have adverse effects on the body's metabolic and absorptive processes, which can all be assessed using this most comprehensive test. As you're probably aware by now, an overgrowth of yeast can virtually affect virtually every organ system, leading to a whole different array of clinical manifestations. So, why is this test so good? Why is my personal choice the CDSA test? Well, if you're going to just take a blood test and look at antibodies, that's all you're going to see is antibodies. Whether they're antibodies that are presently affecting the body or past antibodies. If you're going to do other kinds of tests like saliva tests, that's going to give you a little bit of information, which is not necessarily yeast infection. It could be on bad bacteria or dysbiosis in general. The spit test is not a dumb or a stupid or relevant test as some experts make out to be. I think it's a very useful test, but I think it's overrated and it should be used in conjunction with multiple other tests. But this test gives you a whole lot of bang for your buck, and that's why it's the best test. This test gives me the most useful information, and here are the main points the test reveals. The bacteria culture, as I mentioned before, whether it's good bacteria not so good bacteria or very bad bacteria. Yeast culture, because you can actually culture yeast. So if you've got a stool sample and you can culture live yeast, it's pretty bad. You shouldn't be able to culture live yeast from the stool. We can determine Candida by microscopy, so we can actually see the Candida through a microscope. We can culture it. The culture is very important because, as I mentioned, you've got quite a serious problem. And then we can also not just culture it, but see the level, whether you've got 1, 2, 3, or 4 plus in the yeast and in the bacteria. Parasitology microscopy, Giardia and Cryptosporidium assay, digestion and absorption markers. So we can look at things like elastase, fat stain, muscle and vegetable fibres, whether you've got good carbohydrate digestion, for example. We can see all that through these tests. Inflammatory markers, lysozyme, lactoferrin, white blood cells and mucus. Immunology markers, secretory IgA. Short-chain fatty acids, which are the end product of bacterial fermentation in the colon. And intestinal health markers, red blood cells and occult blood, and also the pH. And also the visual appearance. Now you'll probably think, what the hell does all that stuff mean? Explain to me all those things. Well, we will, but on subsequent videos. Otherwise, we'll end up, taking up all your time. So this is why this test is the Rolls-Royce of tests. It's definitely the best one to use. So if you've been struggling with a gut problem for a hell of a long time, and you've got no idea what you're dealing with, consider the CDSA. All right. Also, please consider doing my yeast quiz. You'll find this at yeastinfection.org. You can always do that quiz to determine, whether you've got mild, moderate, or severe yeast infection. Don't forget about my Candida range of antifungal, antibacterial, antiprotozoan kind of products. You'll see those on candida.com. I'll catch up with you in a subsequent video explaining more of these markers. Thanks for tuning in.